Hello everyone, welcome back to my channel Dr. Dontics. Hope you all doing fine. My name is Dr. Amakabi, a prosthodontist. Today I'm going to talk about major connector of removable partial denture. In my previous lecture video, I have talked about introduction and classification. Hope you find it useful. Now let us not waste the time and begin the lecture. Before beginning with the main chapter, let us know the components of the removable partial denture. As we all know, class partial denture is not a single term. It is a combination of many components which are working together to give you a perfect prosthesis. So here you can see, first is a major connector. It connects the opposing sides of the removable partial denture. In this is the major connector. Minor connector will connect smaller components with the major connectors. So minor connectors include rest, and you can say it includes proximal plate also, and also main base which holds the acrylic part of the prosthesis. Okay, then coming to the direct retainer. This is the direct retainer which is also called as rest. It will rest on a rest seat. And then coming to the indirect retainer. In this picture, indirect retainer is the major connector. There are various indirect retainers. When I talk about indirect retainers, I will tell you in the details. But in this picture, I'm telling you, your major connector is itself acting as a indirect retainer. Indirect retainer will be away from the fulcrum line. This is the fulcrum line. In last class, I told you what is the fulcrum line. So it should be perpendicular. See, the major connector is now acting perpendicular to this fulcrum line. Hence, here major connector itself is acting as an indirect retainer. Next part is the denture base. Denture base is the part of which holds the prosthetic teeth. Next, coming to the minor connector, as I already told you, it joins the smaller component to the major connectors. In this picture, you can see proximal plate and a resin retaining element. This is a resin retaining element which will be looking like this without acrylic part. In this picture, you can see this will look like this. It will hold the acrylic part, and these pores will give you retention for the acrylic. So, will not get detached from it. They will get interlocked in this. So, this is called here. It is the proximal plate. This one. So these are the minor connectors. Next, coming to rest. In this, we will prepare a sausage kind of preparation on abutment teeth to hold these retainers. It will give you support that it will not allow the prosthesis to move towards the underlying soft tissue. In this picture, you can see the clasp assembly grasping the abutment. In this, the one facing the buccal side is the retentive arm. The one facing the lingual side will be reciprocal arm, and it is the rest. In this picture also you can see it is the retentive arm, rest, and the reciprocal arm. It will hold the abutment tooth so strongly and giving strength to the prosthesis. Next, you can see the circumferential clasp over here. It is called as the circumferential as it is holding the abutment. It is forming a circle around the abutment, hence calling it as the circumferential clasp. There are number of class which I will be discussing when I'm going to talk about the direct retainers. So in this I told you it is a retentive arm, rest, and a reciprocal arm. So this is the denture base which holds the prosthetic teeth. In this occlusal, there are three kinds of rest. One is occlusal rest, which will be positioned on occlusal surface of the posterior teeth, hence they are occlusal rest. And second one will be the incisal rest, which will be resting on an incisal edge of the anterior teeth. One more is there, cingulum rest. Cingulum rest, which will rest on a cingulum. Then this part is struts. Struts that connect the occlusal and incisal edge. Struts that connect the occlusal and incisal edge to the remaining of the prosthesis. Then coming to the major connector. Till now I have told you about the general components. Now we talk about the major connectors. So this is the basic picture of the major connector. You can see here it is joining one part of arch to the another part of the arch. Now, what are the properties of the maxillary major connector? So it should be rigid. Why rigid? As it will hold all the components together and form one system. Hence, it should be rigid to avoid flexure between the both sides, and it will protect the underlying soft tissue. Hence, the next thing is protect the associated soft tissue. Then it will provide the means of indirect retention, I told you earlier, and it will provide a means for a placement of one or more denture bases. These are the denture bases. It allows the placement of denture bases on this, and it will promote the patient comfort because it will have a best proprioceptive compared to the acrylic. So in the maxillary arch, the border of the major connector should be 6 mm away from the free gingival margin because it will hamper the free gingival margin, leading to its irritation and inflammation. Either it should be 6 mm away or it should end on a lingual surfaces of the teeth like this to avoid the injury to the underlying soft tissue. In maxilla, it should be 6 mm and in mandible, it should be 3 mm away from the free gingival margin. Next, the border of the maxillary connector should run parallel to the gingival margin like this. So, if you are planning to cross the gingival margin with a major connector, it should be crossed at the 90 degree like this to avoid the injury to the delicate marginal tissue. It should be crossed at the right angle so that little margin will get covered and avoiding damage to the marginal tissue. Next, when the anterior border of maxillary connectors should not end on a anterior slope of the prominent rugae. It should not end on a anterior slope of the prominent rugae. It should end on a posterior slope of the prominent rugae. Avoid prominency in a anterior part. It will affect during phonation and also lead discomfort to the patient. So it should end in a posterior slope of the prominent rugae instead of the anterior slope of the prominent rugae, as it will avoid the thickness of the major connector and patient will be comfortable. Next, the border of the maxillary connector should cross the midline in a right angle like this. Consider this as one plane, okay, and it should end at right angle like this. Here you can see it is ending exactly. Why connector should cross the palatal midline at right angle? Because it will avoid a damage to underlying soft tissue. The major connector should be smooth and rounded, as sharp angles and corner may cause the patient discomfort. Also produce areas of stress concentration leading to the fracture of the prosthesis. Maxillary major connector. Now we'll discuss about the maxillary major connector. There are, before going to maxillary connector, I want to tell you the main property, that is the bead line. Bead line is the fold of the metal like this. It will be towards the tissue, not outside. It will like folding of the metal towards the tissue side. It will give you the palatal seal. It will give you retention. It will hold the prosthesis. So whenever you will remove the prosthesis, if you have given bead line perfectly, then there will be formation of a depression in a oral cavity after removal of the tissue. There will be a depression after you remove this. There will be a depression. Bead lines will have 0.5 mm of width and 1 mm of depth. Now there are 6 types of maxillary major connectors: palatal bar, palatal strap, anterior posterior palatal bar, horseshoe, anterior posterior palatal strap, and complete palate. Palatal bar. Palatal bar will have a narrow half oval shape. So it can mainly used in a class 3 application because it has a short span. Only 1 or 2 missing teeth is good for palatal bar. So it is not used anterior to the second premolar. It should not be used, or it should not be placed anterior to the second premolar. It should be always posterior to the second premolar. What are the disadvantages? They are less rigid and gives you little retention and support because the structure is smaller one, and it will be more harmful to the abutment because it mainly depend upon abutment for the retention. Hence, it will affect the abutments. Now coming to the palatal strap should have a minimum thickness of 8 mm. It should have minimum width of 8 mm. Hence, it will give you better cross section dimension and cross section stabilization. It should not be less than 8 mm, and they are indicated in class 2 and 3 but not in class 1 because in class 1 there will be no posterior abutments. Next, what are the advantages? It gives L-beam principle accepted by the patients normally. It distributes applied stresses over larger area because it covers larger area. L-beam effect. Now what is L-beam effect? L-beam effect is nothing but there will be the different planes. The major connector will be placed in different planes. Consider this as the X plane and Y plane. So whenever there is a application of force vertically and horizontally, because of this L beam, like this. So whenever application of force, it will nullify, counteract the force, and it provides the support or retention to the dislodgement. Hence, it is called as the L beam effect or L beam principles. Then what are the disadvantages? It will cover the excessive palatal area. Hence, if patient not maintain oral hygiene, it will lead to papillary hyperplasia. Hence, you should guide the patient for the proper oral hygiene maintenance. Then coming to anterior posterior palatal bar. This palatal bar consists of both palatal strap and palatal bar together and form a anterior posterior palatal bar. Anterior bar is similar to the palatal strap. Posterior bar is similar to the palatal bar. They are connected with each other by the longitudinal element, this one. It will also have a strong L beam effect because it acting in two planes. What are advantage? Rigidity, yes. It have a minimum tissue coverage because you have an opening in middle. It is used when abutments are separated widely. One abutment is far away from another one. That time you can use the abutment. It have a exceptional resistance and they are used whenever there is a large tori, inoperable tori. Disadvantages, they are uncomfortable and they should not be used when there is a compromised abutments like periodontally weak abutments, and they are avoided in patients with periodontally weak abutment teeth. Now, horseshoe connector, shape of horseshoe, hence it is called as the horseshoe connector. It consists of thin band which run over the lingual surface of the remaining abutment teeth and extend towards the palate. The width of this connector should be 6 to 8 mm. The width should be 6 to 8 mm and there should be symmetry between both the sides. There should not be changing any design or anything. They should be same, similar with each other. It is, if it is like this, then only it is called as horseshoe connector. Then coming to its advantage, primarily used when several anterior teeth are missing. It is used when anterior teeth are missing. It should not be used when posterior teeth are missing. Okay, it is a strong connector, yes, and it is used whenever there is a prominent suture, midline suture, or whenever there is presence of the tori because it is open in the middle. What is disadvantage? It can flex because width is less, and it is poor choice for distal extension. That is class 1, and it has a poor cross arch stabilization. Next, anterior posterior palatal strap. This is different from the anterior posterior palatal bar. In that, there is two bars which are different in shape. But in this, there should be a strap which is 8 mm. Both anterior as well as posterior should have 8 mm width. And they should have a open area, say about 20 into 15. It is the properties of the anterior posterior palatal strap. Advantage, they are rigid connectors and increase strength due to corrugated counter of the metal. What is corrugated? They are nothing but a single sheet of metal which are arranged parallel to each other. This and this. This design is a corrugated metal. Then it is also have a LV effect. Disadvantages, interfere with phonetics and irritation to the tongue. Now coming to the complete palate. Complete palate will have ultimate rigidity and support. It will cover great amount of tissue, distribute great amount of force. Then anterior border either should be 6 mm away or should be lying on a gingival surface of the abutments. Then posterior border should be at the junction of hard and soft palate. Remember, it will won't have PPS as we have that in acrylic, because if you want to record PPS using a green stick, but you can't apply that to a metal. If you're using metal to completely cover, then that time you can't gain that PPS. If you forcibly gain the PPS, it will be harmful to the remaining abutment teeth because metal won't have a properties similar to the acrylic. Disadvantage of it is that it has the bead line. I told you bead line is the main property. It will give you retention. It will give you cohesion, adhesion for the retention. Then what are the advantages of this complete palate? It is used when posterior teeth are to be replaced, and it is used when periodontally weak abutments are present, and it gives you broad distribution of force. Minimal ridge height is present, that is posterior ridge desorption occurred, and dissipation of undesirable lateral and horizontal forces. It have a best proprioception because metal is a thermal conductor and it will pass electrolytes, giving the patient comfortable that comfy zone, and extremely rigid. It will also have a L beam effect, but lesser than any other kinds of connector, that is anterior posterior palatal bar and strap, and it will have the more resistance to the colonization as compared to the acrylic. Then disadvantage, adverse tissue reactions will be there because of poor oral hygiene maintenance, and it will lead to the papillary hyperplasia. So these problems are there. Yes, keep an eye on my channel by subscribing to more or to learn more videos, fun videos like this. And okay, you can also follow me on my Instagram, like and subscribe.